Good evening, everyone. My name is Jill Lefkowitz. I am a registered respiratory therapist over at Valley Hospital. I'm also the educator for the respiratory care department, and I am a tobacco treatment specialist as well. All right, so I am here to discuss the topic of vaping, and this is affecting the general population. Unfortunately, there are still a lot of unknowns regarding this topic, but I am here to provide you with some information about the various products currently sold on the market and how you can educate yourself and your children about this serious topic. So I wanted to share an excerpt of a video about a young girl who experienced a vaping related lung injury. This video is about a minute long, okay?
You hid your vape underneath your pillows.
Yeah.
And you would come and smoke how often?
Oh, I couldn't go longer than like 10, 15 minutes without hitting it. It was so addicting. I brought it with me everywhere I went.
Seema Herman never expected that what she thought was a harmless habit, vaping, would end up nearly killing her.
It took 2 days for my lungs to fail, and I almost died.
The 18-year-old going viral with this photo from her hospital bed, a tube still pumping oxygen to her failing lungs. In her hands, a call to action.
Asked for like a pen and paper because that was the only way I could communicate.
All right, so I'm on mute now, but I can take calls if I
need. That was the first thing
Okay.
I did when I opened my eyes.
Seema's story is just the latest in a landslide of incidents linked to vaping, sparking what many officials are calling a national health crisis.
What we've seen in the course of the past, let's say, month, is an increased number of people who are coming in with respiratory problems as a result of vaping.
So far, the center.
All right. Okay, so now let's begin by going over what exactly an electronic cigarette is. Well, an electronic cigarette was launched in 2007. That is about 15 years ago. They are known as e-cigarettes, e-vaporizers, electronic nicotine delivery systems. And they have a bunch of nicknames. They are some of the nicknames include e-cig, e-hookah, hookah pens, vape pens, mods, and tanks. They're battery-operated devices and no combustions needed. They contain liquids, flavorings, refill pods, cartridges, and other chemicals. And they can also be used to deliver marijuana and other drugs. Essentially, you heat a liquid to produce an aerosol, and that aerosol gets inhaled deep inside our lungs. Now, an aerosol is a liquid or a solid composed of finely divided particles suspended in a gas form. And currently, there's more than 460 different brands on the market. So this picture depicts some of the various types of e-cigarettes. A few slides later, I will show you how they advanced or modified these products to appease the young adults. In this slide, you will see the 4 generations of e-cigarettes and how each evolved. And the first generation is known as a Cigalite. It resembles the same size, look, width of regular cigarettes. It's designed for a one-time use and gets discarded when it runs out of charge or even e-liquid. And it is known as beginner styles. The second generation is known as a vaporizer, vape pens, tanks, mods. These are a larger system and they do have a longer battery life. They produce more aerosol nicotine delivery and they are more customizable and they can be filled by the user. This type is for more advanced users and are largely sold in vape shops online. And the third generation is known as the tank mod system. And this device, the user is able to customize the substance in the device. The type of rechargeable e-cigarette or vaping product designed to be used multiple times. And the fourth generation is a pod mod system, where there are pre-filled refillable pods or pod cartridges with modifiable mod systems. So this is more of a unique design where there's pre-filled pod cartridges that may contain nicotine, THC, or CBD with or without flavorings. And this type uses nicotine salts rather than free-base nicotine. So what exactly is a nicotine salt? A nicotine salt allows particularly higher levels of nicotine to be inhaled more easily with less irritation to the throat rather than free-base nicotine. So this is an example of a disposable e-cigarette. It shows the 4 parts and function of each. The first part I have on this slide is the battery, and this allows the atomizer to heat to about 400 degrees Fahrenheit in a couple of seconds. The atomizer is a coil that converts the e-liquid to tiny airborne droplets, also known as aerosol, which we talked about in the previous slide. There's also a cartridge and a reservoir, and this is what actually holds the liquid solution containing the nicotine, the flavorings, and the other chemicals. And finally, we have the mouthpiece, and this allows the user to inhale the aerosol. Now, the user inhales or puffs on the mouthpiece, which activates the battery-powered device, and this is what creates the aerosol exactly. The individual then inhales that aerosol, deep into your lungs, and bystanders can also breathe in aerosol when it is exhaled. The next few slides will display various types of unique e-cigarette devices. Now, with smartphones being found in the hands of most teens nowadays, this first device is actually a cell phone case that converts to a vaping device. You can attach the atomizer to it as well as vape e-liquids. This is another unique product. This is called the Juul. It is a brand of e-cigarette that closely resembles a USB drive. These have become very popular among teens, and it can be very hard to tell from a distance whether it is a USB drive with data needed for homework or is it actually a harmful device. We have here vape hoodies, which are another popular way to hide e-cigarettes, allowing the teen to vape pretty much anywhere, even in class without being detected. The vape hoodie has tubed drawstrings where vaping devices can be inserted and used discreetly. While this may look like an Apple Watch or a Samsung Galaxy Watch at first glance, with the press of a button, you can turn it into a pod mod kit. And this product holds about 2 milliliters of e-liquid. And the final one here this is known as the Pen Pal. It looks like an ordinary handwriting pen, but in fact, it is a hidden vape pen. This product contains pre-filled vape cartridges that eventually attach to the top of the pen, and the user then can inhale through the mouthpiece. This product holds about 1 ml of e-liquid. It surprisingly writes just like a regular pen and contains additional ink as well. Now we will be discussing some liquid and aerosol components found in e-cigarettes. These are just a few to give you an idea. So liquid components, we have other names for them is e-juice, e-liquid, vape juice, or vape liquid. And this can be a mixture of water, nicotine, food grade flavorings, propylene glycol, and vegetable glycerin.
No, I'm muted.
Becky?
Sorry, I guess I'm not muted.
Okay. As well as THC and CBD. Now, propylene glycol, also known as PG, this is used in food products. When heated, it produces smoke-like vapor. And vegetable glycerin, just to give you an idea as well, is similar to PG, but it's derived from plants used also in food products. When heated, it produces thicker and larger clouds that appeases the young adults. Now, the aerosol components are a little different. They also contain harmful or potentially harmful substances, such as nicotine, heavy metals, such as tin, nickel, and lead, organic compounds, ultrafine particles, cancer-causing chemicals, flavorings, and acrolein, which is known as weed killer. I also wanted to bring up vitamin E acetate. This was found to be an additive in vaping products containing THC. It is also known to be a chemical of concern because of it's so oily. It is an oily substance found in typical household items as well as skin creams. Now, oil may be great on your skin, but when you heat them, it can almost act like grease or glue that can seriously affect your lungs. All right, so we're gonna go over some e-cigarette updates now. In January 2020, the White House, actually an act was created which mandates online age verification for any tobacco product, including e-cigarettes. And it would also require in-person age verification upon physical delivery. There was an exception. The two flavors were tobacco and menthol flavors. And there are thousands of flavors that were in the market: fruit, chocolate, sweets, menthol, mint, cinnamon, vanilla, just to name a few. They did ban the flavors. However, there are still ways that people can buy the flavored cartridges and e-juice. Now, flavors were designed to be eaten, not inhaled. Again, your lungs have a protective coating known as cilia, which acts as a broom, and you want to keep those lungs very, very sterile. Now we will discuss the chemical known as nicotine. Nicotine is a highly addictive chemical that causes a change in brain chemistry quickly and leaves the brain craving more and more. It is found that 99% of all e-cigarettes have nicotine in them. And numerous studies were conducted and suggest that nicotine exposure during adolescence may have lasting adverse effects on brain development. Nicotine can also cause addiction to other drugs as well. Now, in order to understand how nicotine is so good at creating addiction, we must all understand how it takes advantage of our brains. So we're going to go through the cycle, and the cycle of nicotine addiction, there we go. The cycle of nicotine addiction begins with bringing nicotine into the body. So in this case, it enters the body through inhalation of cigarettes or e-cigs, also known as vapes. Nicotine enters the brain and activates the pleasure center of the brain, creating an abundance of dopamine, which is a chemical. After a person finishes vaping, that level of nicotine in the body drops quickly. This drop in nicotine level causes the body to have a strong craving for nicotine that is satisfied by bringing more and more nicotine into the body. Now, all pods contain high levels of nicotine. So to give you an idea, there are 20 cigarettes in a standard pack. Each cigarette contains 2 milligrams of nicotine. The amount of nicotine in 1 Juul cartridge or pod is about the same as the amount of nicotine in a pack of cigarettes. So ultimately, about 200 puffs on the Juul equals 1 pack of cigarettes. Anything that is supposed to be naturally inhaled is harmful for our lungs. There are many ways that e-cigarettes can damage our bodies. So most patients are young, healthy, and symptoms reported are gradual. So it's not sudden. For some respiratory symptoms where people experienced cough, shortness of breath, chest pain. Gastrointestinal symptoms included abdominal pain, nausea, vomiting. And then some other symptoms, there are also people who experienced exhaustion, weight loss, and fevers, as well as increased blood pressure and heart rate. E-cigarettes definitely increase risk of coughing, wheezing, and asthma exacerbations. And there's 2 primary ingredients that are responsible. Again, propylene glycol and vegetable glycerin. It's very toxic to the cells, and the more ingredients in the e-liquid, the greater the toxicity is. So vaping and the effects it has on our lungs, it has affected primarily 17 to 35-year-olds who have no real past medical history. We are going to discuss what popcorn lung is. So popcorn lung, which is closely linked to vaping, is a debilitating irreversible respiratory disease, and it includes scarring of tiny sacs deep inside your lungs, also known as alveoli, leading to excessive coughing and shortness of breath. It is a disease comparative to the disease COPD, also known as chronic obstructive pulmonary disease. So I have a picture here on the bottom, and it shows normal lungs on the left, and then the right picture contains a lung diagnosed with popcorn lung. Now, as you can see, the airways are very inflamed, they're constricted, and they're scarred. And popcorn lung, just to give you a little background information, it includes workers in the popcorn factory that began breathing in diacetyl, which is in return causes bronchiolitis obliterans, which is a serious and irreversible lung disease. And diacetyl is an organic compound. It's a yellow or green liquid, and it's known for its intense buttery flavor. But this was the chemical linked to a serious lung disease. There has been numerous reports about fires and explosions due to defective e-cigarette batteries. So these are some of the risk factors. And again, scientists are still learning and studying the long-term effects, the long-term health effects from e-cigarettes. But we do know that most explosions resulted when the e-cigarette was being charged, and also acute nicotine exposure can be very toxic. So children can come in contact with the e-liquid containing the nicotine. So how can you tell if your teen vapes? So we know that vaping can be easily hidden, and some of the signs of nicotine withdrawal includes anxiety, aggressive behavior, insomnia, weight gain, coughing, and headaches. The physical symptoms include dry cough, wheezing, increase in lung infections throughout the year, shortness of breath during physical activity, maybe changes in school performance, as well as frequent nosebleeds. Now, quitting a tobacco product can be incredibly difficult, and it is important to utilize resources to help support someone who is quitting to become nicotine free and smoke free. So, what can you do? Well, first, you could set a positive example. And best parenting is role model behavior that displays nicotine or tobacco-free housing. You should have an open and honest conversation with your child about the dangers of smoking and vaping. And there are additional resources about tobacco and nicotine cessation as well. A couple other programs that there actually are a couple programs that are offered. There's the national website that offers information on quitting e-cigarette or vape use. There's a national hotline, which I have up on the slide. It's called 1-800-QUIT-NOW. And there is also a great texting program available to help teens and adults quit. And the last one is that Valley Hospital offers a smoking cessation program throughout the year that is run by me and a social worker. So these are some of the resources. And here is the information on the texting program that is offered. So I do want to thank you all for attending tonight, and I hope I was able to give you some knowledge on vaping and the effects it has on our bodies. Again, even though we still don't know the long-term effects of vaping, we do know the effects of nicotine. Okay.
Okay, thank you so much, Jill. At this time, we can open up the, if anyone has any questions about vaping, now is the time to. Do you have any concerns, any curiosity about anything she might not have touched on, or you'd like her to go deeper? We're not getting anything in the chat. Jill, I know at one point you mentioned that vaping, a cigarette pack is, was it, did I misunderstand you when you said smoking a pack of cigarettes is equivalent to smoking how much on a vape?
So it's about equal to 200 puffs.
200 puffs. How many puffs is a normal vape?
Each vape actually, they do say is a little different. They did do a study on the Juul, so I'm comparing it to that particular brand.
There is a question in the Q&A. Someone is asking, can you tell us about marijuana in the vape?
So to be honest, I will do some more research on that. But there's not too many studies, but they did say that primarily kids are putting marijuana in the vape products.
For anyone who is interested, not as far as vaping, but anything about cannabis itself, we are having a program called Cannabis 101 next Tuesday, and it'll be run by Rise, which deals with our medical marijuana here at Northwest. And that program will be both in person and virtual. So you can sign on virtually or meet some of the, just aside. Any smoking is really good, but it's all just, can we get a copy of the slide presentation?
Sure.
How could they go about getting a copy?
Sorry, Becky, I can't really hear you.
Oh, sorry.
No,
How could they go about getting a copy of your slide presentation?
Oh, I guess we could send it out. I don't see a problem with that, right?
And
Kathy?
this webinar will also be available to view again on the Valley site. Is that correct, Kathy? Or will we be able to send it to people who participated today?
This will be shown on the Valley site probably the middle of next week. As far as the slide presentations, Jill, if you want to email it to me.
Sure.
And then I could email it out to the participants. I have their email address when they registered. Is that okay, Beck?
Fine by me.
Okay.
So we had another question come up, and it is, what causes cancer in vapes? Is it a chemical?
So we don't, again, they're still being studied. So I don't have all the answers, but I will say that all these chemicals, if you think about, these devices, cigarettes, in a cigarette, there's 7,000 chemicals, almost 7,000. I think it's like 6,900. And in a vape product, there's a lot that we don't know. So it's just a variety of things that could cause you to have, that can cause cancer. Okay, there's cancer causing agents in there, like we talked about. Just think about all the different things I mentioned earlier. It's just so detrimental to your lungs. Again, your lungs are so sensitive. Anything that's not supposed to be in there affects them.
Of our listeners on tonight, are you interested in, I mean, as we see, Jill has some options of how to make sure you can be healthier and try to get off using vapes. So I hope that will help you in that regard, or you, for what your teenagers might be doing, seeing that the sweatshirt. And I know how orally fixated teens can be putting things in their mouths. And I've seen so many teens put the sweatshirt tab.
Right.
Looking even closer, wondering, are they vaping?
Right. There's all these products that, they don't look like they're vape products, but they really are. That's
And
the
really,
scary part.
it's about being healthy. That's
For
what,
sure.
not trying to curb anybody's position of like, more about like being the healthiest you, right?